Today, we're going to be discussing a great new skin conditioner called Sunekos.
Hi guys, welcome back to the channel. I'm here again today with Dr. Kish and Dr. Ewan, and we're going to be talking to you today about Sunekos. What is Sunekos? Why would you use it? Why should you care about Sunekos?
So Sunekos is a non-cross-linked hyaluronic acid, a little bit like a rival product, Profhilo. But it also has amino acids in which are meant to help improve the effect. So you're meant to get more collagen stimulation and elastin formation in the skin.
The interesting thing about Sunekos is its 2 molecular weights.
Yes, you're absolutely right, because the 2 molecular weights in Profhilo, this is quite a similar product. This has also got different molecular weights. In addition, those amino acids you mentioned, they directly feed the fibroblasts in the skin. So the fibroblasts are actually the cells that produce collagen and elastin. So these proteins give a lovely plumpness and structure to the skin. So that's I suppose the key advantage of this treatment.
Also with the Profhilo, they're in the same syringe, whereas with the Sunekos, they're in 2 different packages.
Yeah. So with those 2 different vials, I suppose it's a little bit more work for us. And the technique is slightly different. If you've had Profhilo before, you know it's 10 injections on the face or the neck or wherever you're having the treatment. It's usually 10 to 12 injections. With this, it's a few more and it's a lot more technique sensitive. I think we've all discovered that. We all had the treatment ourselves recently. And I have to say, you know, the results for me were outstanding. I've really enjoyed them.
10 years younger. Well, maybe not. Maybe not.
So I guess, what's it for? It's for improving the condition of your skin. Your skin is meant to look brighter, healthier, less superficial fine lines and wrinkles. How does it work? Well, it works in 2 different ways because it has 2 different products that we mentioned. So it has a more dense product that you place deep to give deep hydration. You'll usually have 4 sessions in total rather than 2 or 3 per philo. So in the first one, or the last one, or maybe both, we might use some of the denser product for deep hydration, and then in between, we'll use a more superficial product to help target the top layers of the skin. So it's really like sandwiching deep and superficial hydration.
So when I had it done, we used the more dense product in this area here with a cannula, and then the more superficial product with a needle was done underneath the eye, and then kind of peppered around the cheek area as well. I have to say, it didn't hurt, but it was pretty freaky having the injection done right here.
Like it is freaky.
Yeah.
However, there's no other product that I've really come across where you can get the lines really close to the lash
That's
line.
true.
So like Profhilo will spread through the skin. Some of the hyaluronic acid might reach the lash line, but we don't really know how much. With this product, we can really target those lines, and they do trouble a lot of people, don't they? They come in and they really don't like those lines under the eyes. It's pretty good for that, I think.
And I think for the patients who will not have a filler, you know, we all see patients like this who say, I do not want one of the typical aesthetic treatments. I don't want a classic filler. I don't want, you know, toxin or wrinkle releasing injections.
Why?
Yeah, I mean,
why?
you know, but they are.
Yeah,
There's a lot of patients like that who believe that, and I think fair play to them. This kind of answers that need for a lot of our patients. We've got people who just want to look better and glow more, and their skin to reflect the light better, but without necessarily having something that's what they see to be as artificial.
Or change the appearance of their face massively.
Yeah.
They just want to look a bit fresher. So.
I do feel like it gave a little bit of lifting actually when I had the deeper one done here.
And they say that about Profhilo as well. Some people get a really strong response, don't they? Where things do look lifted and tighter. It's not actually marketed to do that, but you really see that in practice. A lot of patients do get that kind of lifting effect. So they're both pretty good at that, I'd say.
It's a hard one to promise though with that one, because if we offer it as a tightening, lifting product, you know, it doesn't work the same way for everyone. I think it is positively beneficial. So what I mean by that is it gives great results, but everyone's results slightly different. So for example, when I have it done, Profhilo or Sunekos, I've noticed that when I look in the mirror, I look better. I can't really pin down exactly why, but I just know I look better. Maybe it's my skin's reflecting the light a little bit better.
Okay, so I guess the big question is going to be, where would you use the Profhilo and where would you use the Sunekos? Like in what type of individual?
So Profhilo for me is for that patient who really just wants quick results, and they're quite happy for us to give them their focus on the mid face and the lower face. because it's so quick. They can be in and out, lunchtime treatment, I suppose. And it's really quite prescriptive. So we can have 2 or 3 sessions. Each one is a month apart, and that's enough as a sort of a loading dose. And then they'll come back for maintenance every 4 months with a Profhilo. So it's a time factor.
I always say 3 to 6.
3 to 6
Yeah.
months.
Yeah.
Yeah, but the research that the company that produces this product has carried out, they found that the in vivo results are best at 3 months. That hydration factor is still active at 3 months. So most of my patients, they will be coming back at 4 months.
Is that good or bad?
So it just depends when it wears off, doesn't it? Some people just find it's gone by 4 months. They need to top up then. If you're lucky, 6. I'm not too prescriptive about the time interval. I just say between 4 and 6. When it's worn off, come back and see me and I'll do your top up for you. I think with Sunekos, it's a little bit more labour intensive for doctor and patient. So you have to come back every week, ideally, at a push 2 weeks, and it's 4 sessions. Whereas Profhilo, you get a month in between the 2 sessions. So Profhilo sometimes fits your diary better, but like we said before, Sunekos can treat areas that Profhilo can't.
Yeah.
Under the eyes, the forehead, you can go direct into the forehead with Sunekos, but you can't with Profhilo. There's no kind of indication for Profhilo in the forehead. Why? We don't really know, but people don't get good results in the forehead with
They don't. I like it in the neck.
Good in the neck.
I like it in the chest. Yeah.
And hands sometimes I use it.
Yeah.
But I think the other thing about Sunekos is because you can really focus, it gives you a lot of freedom as a clinician and even as a patient. I think it gives you that choice of where do I want it? Where's my sort of bugbear? Where's my skin needing the most benefit? And what I noticed was my under eye area, and I noticed almost straight away an improvement.
I mean, you could just be really greedy like us and have both. Okay, guys, I hope you enjoyed that discussion between us about the benefits, drawbacks, the Profhilo, Sunekos, and maybe that's helped you choose which one might be of benefit for you. If you have any questions, leave them below and we'll get back to you as soon as possible and come back in a week for our next video. See you later.
See you.